HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back to HealingYourself.Life. We're your hosts, Dunnigan Kaiser
and Melody Kaiser.
We have with us a very special guest today. Dr. Ernie Murakami is a Professor Emeritus, Associate Professor at UBC Medical Center with degrees in Bacteriology and Immunology from UBC Medical Center. Dr. Murakami is an expert with a special interest in Lyme disease and has treated thousands of Lyme patients and done research into the effectiveness of natural curing methods, including CBD against Lyme. Dr. Murakami, thank you for joining us here on HealingYourself.Life.
Well, thank you, and all the information we can get out and educate the public and the doctors.
Very important.
And politicians. That's the most vital issue that we all have, I guess. Your people have been. I'm a patient myself. I even got a tick myself on my arm, and so I can say I'm not only a warrior in Lyme disease, but also a patient. Are both of you Lyme patients too?
Yes,
absolutely.
Yes, we are.
So that we have in common.
Yeah. Do you have any experience then with Lyme disease? Then how did you get involved in teaching it?
Well, yeah, so I contracted it about 8 years ago in the woods of Wisconsin playing paintball and got a deer tick embedded in my abdomen that we found about 24 hours later and were able to extract intact. But I did get the bullseye rash around that, and within about a week, I felt like about a 97-year-old man and had fevers and chills and aches and just absolute profound fatigue, couldn't get out of bed.
Mm-hmm.
And
I think your test came back negative, though.
But me, I got the standard Western blot test that came back negative, but the doctor went ahead and treated me in Northwest Ohio where we lived. They were not familiar with Lyme, but they looked it up in the book and said to treat me with, I believe it was 10 days of antibiotics, and so I felt remarkably better after the 10-day round of antibiotics and thought that it was all over, but it wasn't. And then in addition to my different symptoms coming back gradually over a period of years, my wife, Melody, then about 3.5 years ago started having symptoms that we didn't recognize as being related to that, but we found out that they were when she finally got 3 out of 5 bands on the test that came back positive for herself. So our subscribers have heard a lot of our story before,
yes, right.
But they haven't heard about how you got involved in Lyme disease. Could you tell us your story?
Yeah.
Well, I've been teaching medical students and residents for 35 years, and one day at a federal penitentiary, I had a medical student who said, "Dr. Murakami, what do you think this circular rash is?" And I said, "Well, what do you think it is?" He said, "Well, I'm not sure." Well, I said, "You work it up, and then we'll see how you make out." So he spent an hour looking at the patient, and he came back and he said, "Well, what was your conclusion?" "I think it's ringworm, and he's got some flu-like symptoms and a touch of arthritis." And I said, "Suppose I told you there was some insect in the center of that ring." Then he said immediately, "Lyme disease?" Questioning me, I said, "Yes, that is Lyme disease." And that was my first case. I had been taught in our clinic. We had a clinic of specialists, and there was a Dr. Bob Sason. He was an internist who consulted, and he told us about the oncoming possibility of Lyme disease. And then I had a rheumatologist at work, Dr. George Price, in my office, and he was a rheumatologist, and he had the first case of Lyme disease, and he told me all about it, and we both presented our interest. His interest was his first case of Lyme disease in BC, serologically positive, proven positive by the Provincial Center of Disease Control. My interest was I developed 2 wood tick removal techniques. And therefore I was presenting it on the Borreliosis conference in Vancouver, and that's when I met all the specialists like Dr. Berscano and Horowitz and you name it, Liegner. They were all there. And I got so interested in Lyme disease after I had my first case, and then shortly after that, I had another case. So I told the infectious disease people in Vancouver, we have a bit of an epidemic here. They said, "Oh, no, we've only tested 1 in 1,000 cases are positive. I said, look, I'm batting 100%
Yeah.
on 2
Whoa.
patients. I said,
Whoa.
your stats are way off. Your statistics doesn't follow what you're saying and what I'm saying. And then all of a sudden, I got a whole influx of people from all over sending me patients, and I was getting successful treatment with antibiotics. That's
Okay.
my routine treatment. And sometimes you had to go into the more complicated combinations, and you had to use the metronidazole family, like flagyl and tinidazole and secnidazole, and we found also plaquenil is another agent that can be used for the cysts.
Uh-huh.
But all of them had serious side effects.
Right.
Like flagyl's got peripheral neuropathy and possible cancer of the pancreas. The tinidazole is the same, and the secnidazole all the same. They had all serious side effects. And the plaquenil had the problem with also permanent peripheral neuropathy. So they all had serious side effects. Anyway, but I was using it because that was the only way to get rid of the spirochete and the survival forms. And it just started with the first case in 1994, second case shortly after that, and I just had gradually built up a whole clan of people who were desperately slipping through the medical cracks.
Right.
Okay.
We had no education. So I started education at UBC Medical School for 5 years about medicine in general. I've been teaching for quite a few years before that. But in medicine in general, then I started to introduce my findings of the 2 cases of Lyme disease. And before you knew it, it was spread around that I was, getting quite knowledgeable about the treatment of Lyme disease. And before I know it, my Lyme practice started to increase more rapidly than my family practice. I had a full practice that was, but the Lyme practice just came more rapidly on that I just had to practice, spend all my time, my spare time. I had to give up my golf and my hockey, which I enjoyed. And I went to Vancouver to see people people all over the world were traveling to see me, because I didn't realize there was a big divide in the medical world. A big divide,
Right.
and it still persists, even to this day. I got a call from a doctor from Seattle that said, Ernie, my doctor practice will be finishing next month. I said, what happened? He showed me a letter, and he said that his colleagues or his college, I don't know what they call it, Office of Professional Conduct, is going to close them up. So he had to close it up. And this happened also to a fellow in Burnaby where I've been teaching, and she was also notified that she's not to practice Lyme disease or else.
Oh my.
This is still going on. And not just that, I had a phone call from Denmark yesterday, and this lady said, I can't get anybody to treat, and I've been going to the States to get treatment because I can't get anybody to treat in Europe. But there are more and more clinics opening up. I think in the Germany area, they're starting to open up. Even in London, I found a place where they have the CBD, which I'll talk about later, being distributed in that area. So it's coming around specifically for the knowledge of Lyme disease. So I don't know how else I can go into more detail at this point, except that my license was, I don't have it anymore. But in a way, I've been traveling across the country, Canada and the States.
Did they take your license away too then, or?
Yeah, I haven't been able to get it. But I've been able to travel across Canada once or twice a year, giving lectures. And I was amazed that I was right across Canada and the States. I would go every time I talk, I'd say, how many people are Lyme disease? Minimum of 50% in every crowd I've had. And I had capacity crowds in places and I couldn't believe it. And some places said, well, you got too many people, you can't get them in because of fire regulations. And I'd have to make another lecture the following day for the amount of follow-up I had to do. These people are desperate, very, very desperate.
Right.
And eastern states in Canada is really, really a pandemic now. Really, really a pandemic. I'll show you a graph that you haven't seen yet.
Great.
Yeah. So anyway, my practice was slightly affected by my wife's illness, and I had to give up the traveling. So I decided I tried Skype like I'm doing now. I can talk quite fluently with that method. I just got talking to a lawyer who I treated 10 years ago, and she was so happy because she couldn't walk. And she has slipped through the cracks. She's seen every specialist possible.
Mm-hmm.
And she was a lawyer, and she was really annoyed, and she stuck up for me. But still, she said, it's either you fight them and spend a lot of money or teach them. And I said, I prefer to teach. And that's what I'm doing now. I do an indefinite amount of teaching and all I can. And when people ask me to give a talk, I'm always there for them.
One of my questions is, so how did you lose your license?
Well, they asked me to come down and explain what I was doing. And I talked about eggs and cysts and side effects and co-infections and Herx reactions. They didn't know what I was talking about. And there was an infectious disease doctor right there. And they're sort of laughing at me indirectly. I could see it. And I said, well, these are things you have to know about for Lyme disease. And this is what I'm telling you now. And they all shook their head as if I was talking about nothing. And there was an infectious disease doctor right there. And I said, first of all, I've conflicted with this infectious disease doctor. What is he doing on the committee? He's a totally unbiased person. Well, I went along with it. So anyway, I gave a dissertation to like everybody else, and I talked about all aspects of it. And they sort of wrote me a letter and said, well, we want to know, what is this cysts you're talking about? I had to give them a lecture about 85 abstracts. I sent them on cysts because they did not know about cysts.
Oh my gosh!
And I said, you have an infectious disease doctor in your committee. Can't you explain it? He said he knew nothing about cysts or eggs, and he said you are talking about something that no one knows anything about. So I got to get the European doctors who had written about cysts and had diagrams and pictures. I sent it to them, and then they shut off that conversation.
Wow.
That went on for years. This investigation by the college. I had to go back and forth and talk about different things. Wow. And then finally they gave up after I convinced them that there are things like cysts and survival forms and Herx reactions and everything else.
Right.
And then they switched it over to looking at my family practice.
Wow.
And they've been on for years and years. And it was terrible stress on my wife.
Yeah.
And finally, I said, look, I've taken the courses you want me to take. I did it just not for my satisfaction. I've been teaching for 35 years. You got letters from the University of Medical School about my ability. They've given me a Professor Emeritus status. Why would they give me that if my knowledge, as you say, that I'm showing signs of, what do they call it? Now, they call me an incompetent zealot.
Oh, no.
Yeah. So anyway, I had to make a decision, and I said, okay, I'm not going to go to any more lectures. I'm giving lectures, I'm teaching all the time.
Right.
Medicine, I feel I know just as much medicine as any doctor that you can talk about, okay?
Wow.
So anyway, I said, I'm not going to take any more courses. I still have to make a living. I still got a big practice. So I stopped going. And then they didn't say anything for the longest time. And then all of a sudden they said, oh, we're sending in 2 doctors. I said, what for? They're going to be examining you for every physical and every history taking that you're doing. So I thought they were kidding at the first. And I spoke to my lawyer and they said, well, they can do what they want. They're an autonomous body. So they sent 2 doctors into my office and it upset me. My whole family was upset.
Yes.
Hope is a very small town. So why are 2 doctors from the college handing out pamphlets saying, we are the college investigating Dr. Murakami, we'd like your permission to be present for every physical and every examination. Well, you know what? Some people just told them to forget it.
Yeah.
Other people who didn't know me that well saying, what the heck's the matter? College investigating? 2 doctors coming to investigate you in the office?
Right.
And it upset my wife so much. And she was really, really physically impaired, almost to the point of depression. She begged me to give it up.
Wow.
Because my health was going down.
Yes.
I was having bleeding ulcers and vasospastic angina, and that's what said, okay. My wife just pleaded with me because she said, they came up. He said, Ernie, you don't look right. You're going to die on us. Mm-hmm. And so I said, okay, I'll give it up, because they were going to come back tomorrow as well. They were to come up whenever they wanted to look at my system of practice.
Yes.
And I said, look, I'm a chief of staff here. I'm head of medical education. I have 15 specialists that work with me. If you're feeling so incompetent, why don't you ask them? They all wrote letters on my behalf.
Wow.
It didn't work out. So finally, my wife pleaded that I give up medicine. And so I did, and for a while I was a bit depressed.
Yeah.
Then I had two choices, and I spoke to the legal people, and I said, well, it's either you sue them or educate them, and I prefer to educate them.
Wow.
Because a lot of my colleagues, like Dr. Charles Jones, he's been investigated, and I'm sure he spent all his money, all his retirement money, and they're still investigating him.
Why do you think there's so much persecution of doctors who know more than this group of doctors? Why are they persecuting you and others?
It doesn't sound like it's only in Canada either, because we've heard the same thing from in the U.S. as well.
It's all. I got people have dialogue with Europe, Europe and Japan and United Kingdom, Palestine, you name it. I got people all over the world who had the same problem. The doctors are divided. But I got to admit, it is changing. The attitude toward Lyme disease diagnosis and treatment is changing, because I've got more medical doctors consulting me, and I've been teaching at the naturopathic medical school. They asked me to come to give a talk at a conference, and they said, we would like you to come regularly. So I've been going there regularly for 8 years now at the Boucher Institute for Naturopathic Physicians. They ask me to come every year. Wow. And they're on board, and I teach them about evidence-based antibiotics for the treatment of Lyme. And now I incorporated in the last few years my findings and research on cannabidiol.
Well, could you just maybe rewind then back to the beginning and bring us forward through how you have a presentation, I understand, about Lyme and what your discoveries were. You mentioned early on that you discovered about its structure and its form being a spirochete similar to syphilis.
Right. Oh yes. How I really got interested in medicine is, as you are aware, that the Japanese people during the Second World War were we lost our father. He was taken prisoner. And my mother and four of us, I was only 10 years old, and my youngest sister was only 4. We were told to get out of Vancouver in 2 weeks and sell everything and get out. And that's what we did. We went to Lillooet, which is 100 miles away.
Okay. And
then we still didn't know where my father was. And we found out he was in Alberta on a road gang. And he's a professional photographer. And eventually they gave permission for him to join us in Lillooet, BC. And it was just basically a tar paper shack, and with 30, 70 degree temperature changes in there. We had a terrific hardship. There was no plumbing, no water, no electricity, no insulated buildings. So we went from Vernon to Vernon from Lillooet. But while I was in Lillooet, I had a fellow who had a fall. And he had terrific abdominal pain. But there was no doctor in Lillooet, no hospital, no ambulance people or anything like that. So he went to Lytton Hospital, about 50 miles away. But he died there. And I said to my parents, I want to become a doctor, because there was no doctor there. That was my first interest in becoming a doctor.
Okay.
But my parents said, we're flat broke. We've lost everything during our internship. So think of some other career.
Yeah.
Well, we went to Vernon because they wanted orchard people, and I was about 12, 13, but you could still work in the orchard picking apples and doing some kind of work. So we went to Vernon, and we were still there. The war was still going on, and my father was a photographer. He joined us, and he was able to work as a photographer. And anyway, we were able to exist fairly normally because we were all working. And my sister got extremely ill, and she said, she's coughing and feverish, and my mother and father were herbalists. They believed in ginseng and roots of trees and insects and this sort of thing, and suction cups and that sort of thing. They tried everything, but she kept coughing and she got worse and worse. And I could see her progress, going pale and paler, and not eating and losing weight. And finally, Dr. Alexander came to the house in Vernon and said, your sister's got bilateral pneumonia. We've got to get into the hospital right away.
Wow.
So she went to the Vernon Jubilee Hospital, and it was schools right there. So I was watching her, and she deteriorated very rapidly in a week. And eventually, Dr. Alexander said, your sister's going to die. She's got every benefit of all what we have. And so we went to the Anglican church. We were Anglican church and said our prayers. And we thought we had seen the last of my sister. And that night, there was a knock on the door by the landlord, and he said you to go to the hospital right away. We had assumed that she had died because she was, so sick.
Yeah.
Yes.
But they said that her status is no different. But in the Army base, there's a drug called penicillin. And it has been used for the military, but there was a surplus that was going to be expiring, and your sister is considered the worst or the sickest person in the hospital. So she was given the choice by my parents to decide whether they can use the penicillin on her or not.
Okay.
At first, my mother and father said, no, we don't want to experiment with anybody. She's going to be the first civilian to get this antibiotic. We don't want her to experiment. We wanted her to die a natural thing, because they were very religious. But I told my mother, I said, penicillin comes from a mold. It's a plant. It's not a chemical.
Okay.
Yes.
As soon as I said that, that made them happy. But we were also advised about the fact that there was acute anaphylactic shock, because when they first came out, they were so impure with other foreign bodies on it. So they were kind of hesitant. But I said, Mom, she's going to die if we don't do something now.
Right.
So they agreed to take the penicillin by injection, and she had 25,000 units 3 times a day, which is minimal.
Okay.
But in 2 days, she was talking to us.
Wow!
Oh.
Wow! Oh, wow!
I got some photos I can show you on that later if you want. But anyway, that made my interest in medicine even greater. I told my mom I want to become a doctor.
Yeah.
Yes.
She said, "Well, take up something similar." So I took up pharmacy, and I took a rotation through a pharmacy to see what they did. But I didn't enjoy what they were doing. They were just selling more candy and medicine, and there's there, but that's not what I wanted to do.
Yeah.
So I decided to go to UBC to get a degree in bacteriology. That at least is my medical interest. And I was so fascinated how an antibiotic like penicillin killed pneumococcal bacteria.
Right.
So I took up bacteriology, and that's when I discovered syphilis in my graduation thesis. And at that time, I fortunately came up with a Dr. R.B. Kerr, who was head of internal medicine, and he'd like to have an adult to live with his 3 sons, because he was traveling a lot. And I said, okay, I'll do that. I became their big brother.
Oh, wow.
And Dr. Kerr said, you're interested in medicine, aren't you? I said, yes, I am. And I told him about the experience with the person who had died with abdominal injuries in Lillooet, and my sister who made a miraculous recovery of penicillin. He said to me, Ernie, go into medicine and don't worry about a thing.
Wow.
So without Dr. Kerr, I wouldn't be here as a doctor right now.
Wow.
He was backing me up to tell me that if I ever got into any financial problems, he would be there for me. The whole family would be there for me.
Wow.
And also, when he said that, he gave me the confidence that I had the ability.
Yes.
Often you think, do I have the ability to become a doctor?
Yes.
And so I applied and I got accepted. And I thanked Dr. Kerr, and he says, well, I couldn't speak for you because you were like my son, but I knew that one day he came and told me, you've been accepted. Don't tell me.
Oh, that's awesome.
Yeah. So when I went to finish my internship, and he said, Ernie, what did you like about medicine? I said, I liked everything. Like, I liked the surgery, I liked the pediatrics, I liked the delivering babies, and emergency work. I loved them all. He said, Ernie, you're made for family practice.
Okay, sure.
Okay.
But even then, so I went to practice and do family practice, and I went to a place called Braylorn. It's a gold mining town.
Okay.
And it's a one doctor town. And I liked the idea of doing things. And Dr. Robertson met me, and he said, what took you so long getting to Braylorn, where you are right now? He said, well, you didn't tell me the road. I had to clear my road. I had to clear the road to get there. So therefore,
wow, that's remote.
I'm late. And he said, well, I want to go get away on my holiday with my wife. I said, but you won't be able to go down that road. It's got too many slides. I had to clear the road to get up here. So and he said, well, okay, then drive me to the over to the building over there on the hill. I drove over, and I said, what's over there? He said, my plane is there. He said, I'm going to take off because I've been waiting to take off to go take a holiday. So anyway, I drove him to the airport there, and then he took off, and I never felt so alone, just out of internship.
Wow.
Here I'm alone. And he says to me, oh, yeah, before I go, I got to tell you, it's an acute abdomen emerge, and I got a maternity case that's due.
Oh, wow. Wow.
So I said, okay, that's great. So anyway, I went to the hospital, and sure enough, acute abdomen, right lower quadrant, a ruptured appendix.
Yep.
So I had to get Dr. A.D. McKenzie, my teacher in surgery, to guide me through the whole program of repairing this ruptured appendix.
Wow.
Oh my gosh.
That was my first case out of
Welcome to
medical
the big
school.
leagues, huh?
Enter and big the league, yeah. And I was all of a sudden doing that.
Wow.
And I did the whole thing, and I was never so happy when he said to me next morning, "Oh, I'm in pain. Bring me something for pain." I said, "I'm glad you're even talking."
Yeah.
Anyway,
Wow.
that first case was a big lesson for me.
Wow.
Yeah.
And the second case was the delivery came ahead, and the girl, she delivered really well. The first baby.
Oh.
The first
I
baby.
didn't realize there was no idea. It was a twin in there,
Wow.
and I had given the oxytocin to stop the bleeding.
Oh,
The
shoot.
woman cramped down,
Oh yes.
So-
Yes.
so I was told to use some ether to try and relax the womb, but it's so nauseating, and she got sick, and the fetal heart went a bit faded, and the nurse said, "You better do something."
Oh, my.
So I had to take a Metzenbaum scissors, cut the womb, and pull the baby out.
Ouch.
And she bled, of course, bled. But she did all right. She ran
Okay.
through
Wow.
yeah. So that's my first experience and how I got into medicine.
Boy,
Wow,
that's
that's-
a very dramatic entry into your first two cases. And how did it lead from that
Well,
to your interest in Lyme?
My third
Oh.
case in the same week, this fellow had fallen at the legion and hit his head,
Okay.
and he had been told by the RCMP, "Ernie, this guy's arm isn't moving on the right hand and the right leg." Oh, I said, "Oh no, he's got a contractile injury. He's got a hemorrhage." So sure enough, I phoned Dr. Turnbull, my neurosurgeon. I said, I got a problem here. I got a patient with severe, paralysis on the right side after a fall. He said, "Well, you got to do some burr holes." Believe it or not, I had to do burr holes
Oh, my.
on the side to relieve the pressure, and the fellow made it okay.
Wow.
Oh, my
That's
gosh.
great.
That's
Wow.
my first experience in family practice.
Well,
Okay.
you had a trial by fire there. And how did the
Okay.
path lead you to Lyme disease then?
Well, I came to Hope because there was an opening here,
Okay.
and I was thinking of pathology at one point, but it wasn't opening, so I came back to Hope, and then I got married, met my wife, and then I decided, well, I can't afford to go into pathology anymore.
Yeah.
And then I had my first case of a tick bite in 1994,
Okay.
and that's when I saw the tick and the rash and everything else, and successful treatment with 3 weeks of 3 or 4 weeks of antibiotics, and a serologically positive case.
Okay.
And then my second case was in Hope, 25 miles away, and I said, "There's an epidemic here," but then I couldn't convince anybody.
Right.
And they went around looking at all the areas in this BC area, although they found different lakes and different moist areas had a higher content of ticks
Okay.
with Lyme disease in it.
Now, are you?
Sorry.
Okay, I was going to ask the other question. With the deer tick, we've been told, it's only the deer tick that carries it. How do you feel about that? Do you think other ticks are carrying Lyme now too? And
Oh yes, definitely. In Germany, they found mosquitoes with the EDA particles in the bowels of mosquitoes.
Oh.
Black flies, sand flies, anything that bites a rodent, like a deer mice,
yeah.
can cause a transmission into the bowel system of an insect that bites, and if it bites an animal or man, that spreads the disease.
Okay.
But it isn't just deer mice now they're finding it. They're finding it in squirrels,
Okay.
chipmunks, and shrews. So therefore, we got to do a more comprehensive study of all the animals and all the insects that could be potentially harboring this disease, because there's a major pandemic out eastern Canada and the States.
Wow.
Mind you, Canada is lily white, but if you look at the map of the States, it's terrifying.
Yes.
It is.
Yeah, I think your presentation includes a Lyme incident map that demonstrates that.
Right. So can I go on to anything further? Do you want me to go on to my slides now? Or?
Sure.
Sure, you
That'd be
can.
great. That would be great.
Yeah.